Hello, and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to cancer disorders, tailored for both NCLEX and Prometric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Question 1. A 45-year-old female client has been diagnosed with stage 3 breast cancer. She is scheduled to undergo a modified radical mastectomy. The client expresses concern about her body image and requests information about breast reconstruction surgery. What is the nurse's most appropriate response? A. Breast reconstruction is not recommended for stage 3 breast cancer patients. B. Breast reconstruction can be performed during the same surgery as the mastectomy. C. Breast reconstruction can be considered after you complete your cancer treatment. D. Breast reconstruction is only offered to women under the age of 40. Answer C. Breast reconstruction can be considered after you complete your cancer treatment. Rationale: breast reconstruction surgery is typically considered after cancer treatment is completed to ensure the best possible outcome. It is essential to address the client's concerns about body image and provide information about available options. Question 2. A 60-year-old male client with lung cancer is receiving chemotherapy. The client develops neutropenia. What nursing interventions are most appropriate for this client? A. Encourage the client to eat a diet high in raw fruits and vegetables. B. Limit visitors to prevent exposure to infections. C. Administer subcutaneous injections of apolitin alpha. D. Initiate prophylactic antibiotic therapy. Answer D. Initiate prophylactic antibiotic therapy. Rationale: neutropenia is a condition characterized by a low absolute neutrophil count, which increases the risk of infections. Initiating prophylactic antibiotic therapy can help reduce the risk of bacterial infections in clients with neutropenia. Options A and B are important for infection control but do not directly address the neutropenia. Apolitin alpha option C is used to stimulate red blood cell production and is not indicated for neutropenia. Question 3. Client is receiving external beam radiation therapy for prostate cancer. The nurse is providing education about potential side effects. Which side effect should the nurse emphasize as a priority for the client to report immediately? A. Fatigue. B. Skin irritation. C. Urinary frequency. D. Rectal bleeding. Answer D. Rectal bleeding. Rationale: rectal bleeding is a potential side effect of radiation therapy for prostate cancer and can indicate damage to surrounding tissues. It should be reported immediately to the healthcare provider for further evaluation. While the other options are common side effects of radiation therapy, rectal bleeding is more concerning. Question 4. A client with multiple myeloma is admitted with severe bone pain and hypercalcemia. Which intervention should the nurse prioritize for this client? A. Administering for fluids to promote hydration. B. Providing pain management with opioids. C. Administering alendronate to decrease calcium levels. D. Administering erythropoietin to stimulate red blood cell production. Answer A. Administering for fluids to promote hydration. Rationale: hypercalcemia is a common complication of multiple myeloma. Hydration with 4 fluids is a priority intervention to help lower calcium levels. Pain management option B is important but should be preceded by addressing the hypercalcemia. Alendronate option C is used to treat osteoporosis, not hypercalcemia. Erythropoietin option D is used to stimulate red blood cell production, not to treat hypercalcemia. Question 5. A client is receiving chemotherapy for ovarian cancer. The nurse notes a low white blood cell count WBC on the lab results. What precautions should the nurse take to protect the client from infection? A. Place the client in a private room with negative pressure. B. Restrict all visitors, including family members. C. Ensure strict hand hygiene and infection control measures. D. Administer prophylactic antibiotics as ordered. Answer C. Ensure strict hand hygiene and infection control measures. Rationale: While all options are important for infection control, strict hand hygiene and infection control measures are the most critical in preventing infections. In immunocompromised clients, options A, B, and D may be necessary in some situations but should not take precedence over basic infection control measures. Question 6. A 55-year-old client has been diagnosed with colorectal cancer and is scheduled for surgery to remove the tumor. The client expresses anxiety about the surgery and its potential complications. Which nursing intervention is most appropriate to address the client's anxiety? A. Encourage the client to avoid discussing the surgery. B. Provide information about the surgical procedure and expected outcomes. C. Administer a sedative medication to reduce anxiety. D. Suggest the client consult with a mental health professional after the surgery. Answer B. Provide information about the surgical procedure and expected outcomes. Rationale: providing information and education about the surgical procedure and what to expect can help reduce anxiety in the client. Option avoids the issue and does not provide support. While sedative medications option C may be necessary in some cases, it is important to address the anxiety with education first. Option D may be considered if the anxiety persists and becomes a significant issue. Question 7. A client with leukemia is receiving chemotherapy and experiences severe thrombocytopenia. Which nursing action should take the highest priority for this client? A. Administering platelet transfusions as prescribed. B. Monitoring the client's temperature for fever. C. Providing pain management for bone pain. D. Encouraging a high-fiber diet to prevent constipation. Answer A. Administering platelet transfusions as prescribed. Rationale: thrombocytopenia is a condition characterized by a low platelet count, which increases the risk of bleeding. Administering platelet transfusions is the priority to prevent or manage bleeding. While options B, C, and D are important, they are secondary to addressing the thrombocytopenia. Question 8. A client with pancreatic cancer is experiencing severe pain and is prescribed opioid analgesics for pain management. The client expresses concerns about opioid addiction. What is the nurse's best response? They: you won't get addicted to opioids if you take them as prescribed for pain. B. Opioid addiction is a common side effect, but we can try other medications. C. I understand your concerns, but pain control is essential for your comfort. D. We can discontinue the opioid and use non-opioid pain medications. Answer C. I understand your concerns, but pain control is essential for your comfort. Rationale: opioid addiction is a legitimate concern, but adequate pain control is crucial for the client's comfort and quality of life. Option A is dismissive of the client's concerns. Option B is not entirely accurate, as opioid addiction is a potential side effect but does not occur in all cases. Option D may not provide sufficient pain control for the client. Question 9. A client with Hodgkin's lymphoma has been receiving radiation therapy and is experiencing radiation dermatitis on the chest and neck. Which nursing intervention is most appropriate for managing this side effect? I'd apply a hydrocolloid dressing to the affected area. B. Cleanse the area with a mild, fragrance-free soap and water. C. Administer topical corticosteroid cream as prescribed. D. Encourage the client to expose the area to sunlight for short periods. Answer B. Cleanse the area with a mild, fragrance-free soap and water. Rationale: maintaining good skin hygiene by cleansing the affected area with a mild, fragrance-free soap and water is essential for managing radiation dermatitis. Option A is not typically used for radiation dermatitis. Option C may be prescribed for severe cases, but cleansing should be done first. Option D is not recommended, as exposure to sunlight can worsen skin damage. Question 10. A client with metastatic bone cancer is at risk for pathological fractures. Which nursing interventions should the nurse implement to reduce the risk of fractures in this client? Select all that apply. A. Encourage weight-bearing exercises. B. Administer bisphosphonate medications as prescribed. C. Provide a low-calcium diet. D. Use a lift sheet for repositioning the client. E. Implement fall precautions in the client's room. Answer: B, D, and E. Rationale: administering bisphosphonate medications, option B, helps strengthen bones and reduce the risk of fractures. Using a lift sheet for repositioning, option D, minimizes the mechanical stress on bones, reducing the risk of fractures. Implementing fall precautions, option E, helps prevent accidental falls, which can lead to fractures. Weight-bearing exercises, option A, may not be suitable for a client with metastatic bone cancer. And a low-calcium diet, option C, is not appropriate, as calcium is necessary for bone health. Question 11. A 60-year-old client is diagnosed with non-small cell lung cancer and NCLEX, and is scheduled to undergo a lobectomy. The client asks the nurse about the purpose of the surgery. What is the nurse's best response? A. The surgery will cure your cancer completely. B. The surgery will remove the affected lung tissue to control the cancer. C. The surgery will only provide temporary relief from your symptoms. D. The surgery is experimental and may not be effective. Answer B. The surgery will remove the affected lung tissue to control the cancer. Rationale: a lobectomy for an NCLEX aims to remove the affected lung tissue to control the spread of cancer. Complete cure, option A, may not always be achievable, and the surgery is not experimental, option D. Option C is not entirely accurate, as the goal is to control the cancer's progression. Question 12. A client with cervical cancer is undergoing radiation therapy. The nurse instructs the client to maintain proper skin care in the treatment area. What is the most important aspect of skin care for this client? A. Application of an over-the-counter skin moisturizer. B. Avoidance of sunlight exposure to the treated area. C. Keeping the area dry and avoiding moisture. D. Use of a gentle, fragrance-free soap for cleansing. Answer: B. Avoidance of sunlight exposure to the treated area. Rationale: the most important aspect of skin care for a client undergoing radiation therapy is to protect the treated area from sunlight exposure, as it can exacerbate skin damage and increase the risk of burns. Options A, C, and D are also important, but are secondary to sun protection. Question 13. A client with bone metastasis from breast cancer is experiencing severe bone pain. The healthcare provider prescribes palliative radiation therapy. What is the primary goal of palliative radiation therapy in this case? A. To eliminate the cancer cells completely. B. To prevent further spread of cancer to other organs. C. To shrink the tumor size for easier surgical removal. D. To relieve pain and improve the client's quality of life. Answer: D. To relieve pain and improve the client's quality of life. Rationale: the primary goal of palliative radiation therapy is to provide relief from symptoms, such as pain, and improve the client's quality of life. Complete elimination of cancer, option is not the goal in palliative care. Options B and C are not the primary purposes of palliative radiation therapy. Question 14. A client with leukemia is at risk for developing anemia due to bone marrow suppression from chemotherapy. What should the nurse prioritize in the care plan to manage anemia in this client? A. Administer erythropoietin to stimulate red blood cell production. B. Encourage the client to consume a high-protein diet. C. Monitor the client's platelet count daily. D. Administer antifungal medications as prophylaxis. Answer: administer erythropoietin to stimulate red blood cell production. Rationale: erythropoietin is used to stimulate red blood cell production and is appropriate for managing anemia in clients with bone marrow suppression. Options B and C do not address anemia, and option D is unrelated to the management of anemia. Question 15. A client with advanced gastric cancer is experiencing severe nausea and vomiting after chemotherapy. The nurse is planning interventions to manage these symptoms. What should be the nurse's first action? A. Administer an antiemetic medication as prescribed. B. Encourage the client to eat small, frequent meals. C. Offer the client ginger tea to help alleviate nausea. D. Assess the client for dehydration and electrolyte imbalance. Answer: D. Assess the client for dehydration and electrolyte imbalance. Rationale: before administering antiemetic medication or offering home remedies, It is essential to assess the client for dehydration and electrolyte imbalance due to severe nausea and vomiting. Once the assessment is complete, the nurse can proceed with appropriate interventions. Question 16. A 70-year-old client has been diagnosed with prostate cancer and is discussing treatment options with the healthcare provider. The client is concerned about potential side effects of treatment. What side effect is most commonly associated with radical prostatectomy? A. Erectile dysfunction. B. Hair loss. C. Peripheral neuropathy. D. Nausea and vomiting. Answer: A. Erectile dysfunction. Rationale: radical prostatectomy is a surgical procedure to remove the prostate gland, and one of the most common side effects is erectile dysfunction. Options B, C, and D are not typically associated with this procedure. Question 17. A client with acute myeloid leukemia (AML) is receiving induction chemotherapy. The client's platelet count drops significantly, and the client develops petechiae and ecchymosis. What is the nurse's priority intervention? A. Administering platelet transfusions as prescribed. B. Initiating contact isolation precautions. C. Encouraging the client to avoid physical activity. D. Administering prophylactic antibiotics. Answer: A. Administering platelet transfusions as prescribed. Rationale: petechiae and ecchymosis are signs of severe thrombocytopenia, low platelet count, and can lead to bleeding. The priority is to administer platelet transfusions to prevent bleeding. Options B, C, and D are important but are secondary to addressing the thrombocytopenia. Question 18. A client with advanced lung cancer is experiencing dyspnea and severe pain. The client is receiving oxygen therapy and opioid analgesics. Which assessment finding should alert the nurse to potential opioid overdose in this client? A. Decreased respiratory rate. B. Improved pain control. C. Increased level of consciousness. D. Decreased blood pressure. Answer: A. Decreased respiratory rate. Rationale: a decreased respiratory rate can be a sign of opioid overdose. It is crucial to monitor the client's respiratory status when administering opioid analgesics and to intervene promptly if respiratory depression occurs. Options B, C, and D may not be indicators of opioid overdose. Question 19. A client with breast cancer is receiving adjuvant chemotherapy and is at risk for chemotherapy-induced nausea and vomiting. CINV. What is the most appropriate nursing intervention to prevent CINV? A. Administer antiemetic medications after the client experiences nausea and vomiting. B. Encourage the client to eat large, well-balanced meals before chemotherapy. C. Administer prophylactic antiemetic medications as prescribed. D. Offer the client ginger tea during chemotherapy. Answer: C. Administer prophylactic antiemetic medications as prescribed. Rationale: the most effective way to prevent CINV is to administer prophylactic antiemetic medications before the client experiences nausea and vomiting. Option is reactive and not as effective. Options B and D may be helpful, but should not replace the use of antiemetic medications. Question 20. A client with leukemia is undergoing hematopoietic stem cell transplantation (HSCT). The nurse educates the client about the risk of graft versus host disease (GVHD). Which statement by the client indicates an understanding of GVHD? A. GVHD occurs when the transplanted cells attack my own body's tissues. B. GVHD is a common side effect of HSCT and is not a cause for concern. C. GVHD only affects the transplanted cells and not the rest of my body. D. I will be immune to all infections once I have GVHD. Answer: GVHD occurs when the transplanted cells attack my own body's tissues. Rationale: GVHD occurs when the donor's immune cells attack the recipient's tissues, and it can affect various parts of the body. It is essential for the client to understand this process as part of HSCT education. Options B, C, and D provide inaccurate information about GVHD.